Hello, and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative, interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. Hello, my name is Adrienne Cleverly, and today we are joined by Dr Tash Kennedy, who is a Senior Research Officer and Data Scientist for the National Centre for Population Health and Wellbeing Research at Swansea University. Her research interests lie in utilising statistics to analyse and model life course data, such as social service, education, early years and health data. So hello, welcome. Thank you for joining us.
Oh, thank you for having me.
Well, your research looks at children in care.
Mm-hmm.
So can you tell us what it is you're looking at exactly?
Okay, so the project is called Carelink Wales, and we are looking at the outcomes for children who enter care versus their propensity matched opposites that do not enter care. So we're looking at what factors lead them to be taken into care initially, and then using that to match them with a general population cohort, and then also a child protection register cohort. So these are children who are in a bad situation, but they don't enter care.
Yeah.
And then we're looking at the outcomes. So mainly it's educational outcomes, health outcomes, and then employment outcomes.
So these are things that can ultimately help shape them later in life, I guess, really, aren't they?
Yeah.
So as a data scientist, what kind of data is most useful to you to understand what it is you're looking at for these outcomes?
Yeah, so for this project, we were looking at longitudinal data. So
right,
that's
okay.
Data collected over a very long period of time. So we've gone all the way back to 2000, and we've gone all the way up to 2020. So it's 20 years of data where we can track these people through different systems, through different, even different data sets. So the Welsh data sets, we can make sure they're in Wales.
Yeah.
And then the health data set to see if they're interacting with hospitals or GPs or even emergency departments. And then the education data set, we've got quite a few different education data sets there. And then also the census we now have as well.
Looking at that then, what are the health trajectories for children in care? Are they?
So as soon as they enter care, they end up coming more in line with the general population cohort. So they're visiting the A&E emergency department, which we decided was probably the worst outcome.
Yeah.
If you're visiting the emergency department, something really bad has happened to you. And they end up with visits like less than one a year, similar to the general population. So that's had a really positive influence over their health. On the other hand, their GP appointments are going up. So they're actually visiting a GP more than they were before being taken into care. But looking deeper into the codes, it's because they're having more vaccines. So it's positive GP interactions rather than negative GP interactions. So that's a really good outcome for them.
It's one that sort of puts them in line, as you said, with the different like groups that you were looking at. So in terms of looking at some of those trajectories then, you just touched a little bit on it in terms of their visits went up, so it looked a little bit like it wasn't, but it was a positive visit. Mm-hmm. Are there any challenges in using data science that you can foresee or that came about from doing this research?
Yeah, so we can only see the data, so we can't put any context behind the data.
Yeah.
This is where patient and public involvement comes in. So the PPI group members, we have a few different groups and we take our results to them and they then put the context behind it. So for example, one of the ones we had said that having more adults in the household was actually a bad thing. But then we took it to the PPI members and they said, actually, I live with my parents, so we're a generational living household, and that's really beneficial.
Yeah.
Especially when there are days where she can't provide the care. The grandparents can step in and take care of this child. And she said, without that support, her child might have been taken away and put into care. So there's factors like that, which are like, okay, we definitely need the context behind the numbers we're seeing, because otherwise we could lead to quite a harmful interpretation that causes more harm to children rather than more benefits to the children.
And you've already highlighted that with the GP visits. It's a case of why are they going in, and it's actually for a positive reason that they're going in. So you sort of touch there, you're on the intersection of social care and data science. is it hard to bring them together, or how do you bring them both together?
So I'm quite technical as a person. So then looking at the data and trying to put it into a way that's understandable for general public, I sit there for quite a while trying to be, okay, I need this to be sensitive and also get the message across.
Yeah.
And make sure people can understand it so I can get the context back instead of just causing confusion or potential harm, because these people they're in our PPI groups and we are really grateful to have their input, but we don't want to cause them any distress by potentially offending them with what our data is showing. So we need to word it quite like technically, but not technical.
Yeah.
It's quite difficult for me, but I get there in the end. And I'm just like, this is a very steep learning curve. It's not what I'm used to.
But it's working though, because you are getting the context behind the data that you're talking about. And also it's really good that you have to sort of work in that way, because to broaden your ideas behind the context, it can sort of help take the research in a direction you hadn't necessarily anticipated.
Yes, definitely.
Has that happened?
Yes, we've actually had quite a lot of feedback where we've ended up going in a direction we hadn't intended. We've added more codes in from things we hadn't considered because of the PPI input, and then we've looked at outputs. For example, the employment outcomes, we weren't able to look at them, but then we had a look at the census and we had feedback from PPI, and then we asked ONS, and that strengthened the support to actually have the ONS data. So we were allowed to have the census data because of their support.
So it's had a huge impact just by having bringing the two worlds together, essentially.
Yeah.
That's amazing. So with the big data or advanced analytics, what does that tell us about the child in care in terms of traditional research? They might have missed some of the stuff that you've actually found, mightn't they?
Yes, because we can link from so many different sources. It's more of a holistic approach rather than just this is a siloed outcome. So we can actually give that more holistic approach to the outcomes and give them a more comprehensive overview. Because there was the Children's Act of 1989, I think. Yeah. It was that the children's best interests have to be a priority. Yeah. And I would say that the children's outcome from having this massive life experience should be a big priority, because it will impact for the rest of their lives, as we've discovered from this data. So
it does, doesn't it? The early years shape what direction they kind of take in the future. So can you tell us a little bit more about Carelink? Sorry, just because we sort of diverged away from it, and that's a big piece of research that you've been working on.
Mm-hmm. Yeah, so it's been the last 2 years. It was funded by NIHR. We're nearly at the end of it now, so we've done quite a lot. We've managed to produce a tool that we're hoping to be released from the Gateway that can help service providers make informed decisions from this research. So we can give them, they can only give a profile. So they go, this child is between this age, and this is the sort of demographics that they are in. And then it can give sort of a Q risk score of how likely they are to go into care. Yeah. And then they can then use that to inform if they would have better outcomes by being taken away and put into care, or if there should be other interventions to allow them to remain in the family home. Because some research from one of the PPI groups showed that children just want to be loved, which is really sweet. And it's quite sad that that's what they want, and then there are some children that aren't getting that. Yeah. So being able to make that informed decision and then put either interventions in place that can allow them to remain in home, or put them into care if that is the best outcome for them. Because there will be some children who are in a situation where going into care is the best thing for them, but not all children should be taken into care. Yeah,
and I guess you can't really predict either, can you? You know, what the outcome would be if they stay where they are, or what it would be. You can kind of look at a model and see what will be best, but...
Yeah, so we actually have a technique that we've been using, which is called synthetic controls.
Okay.
And with the synthetic controls, you take the child and you can look at using historical data, so historical children who've gone into care, you can use that to help inform future decisions. So with a synthetic control, you can test the counterfactual. So this child went into care, here's the counterfactual, they didn't go into care. And with that, we've used our propensity matched general population. So these are the children who are in the general population who have the same risk factors but then don't end up in care. And that was from the earlier work packages. So we've informed everything throughout. But with this, you can actually say, okay, look, this child, they have this intervention here. Do they would they have gone up and
Yeah.
kept going up if they had not been in care, or did they actually come down? So you can see how it goes based on, and it's this amazing technique, and we've managed to trial it, and then we took it to a conference, and people were really interested and they want to know more. So
Yeah, I was going to say that is something that's so, because it is almost a predictor, isn't it? To
Yes,
sort of
yeah.
to determine which is the best course for them.
That's how we were able to assess, like, okay, the children, when they go into care, their A&E admissions do go down, and you can see how many admissions they would have had if they hadn't been taken into care.
That's incredible. I'm a bit like, wow. So
it's really exciting.
It is. That's really, really cool.
This is what the tool is based on. So hopefully we can help make that best decision, or inform the best decision. So we won't be making the decision, but we're providing the tools to allow people to make a better decision for the children. I'd like for the children to be involved in their decision, but
yeah,
this is hopefully something that helps standardise it across Wales as well, because I know different local authorities have different different thresholds for taking a child into care.
Yeah. And again, we touched on like populations, because it is different as well, isn't it, in terms of what is their access like and things like that, because that will, I guess, have a impact on the decision ultimately.
Yes, because of SAIL, which is a whole Wales-wide data set, we actually have the whole data set for Wales. So we're not just looking at a sample, we're looking at an entire population. And it's led to some research called Serena, which is a European Horizon funded grant.
Yeah.
And we're going to be comparing what we found in Wales to what we found in England and Denmark, because Denmark's actually quite similar to Wales with the richness of their data.
Oh, wow.
So we can hopefully upscale this further than Wales.
That would be incredible.
Yeah.
So this piece of work that you've just completed, it focuses on the risk factors, is that right?
Risk factors and outcomes.
So what are some of the key risk factors then?
So some of the risk factors are mainly around the amount of children who've been born, and sadly, some of the risk factors are also just to do with the mother, and this is a detriment of the data.
Yeah.
We're currently unable to track the father. We can track the amount of parents or adults in the household, but we don't know the father figure. That's hopefully another bit of research we're going to do, which would maybe give some paternal factors rather than just maternal factors, because it can, if it's worded wrongly, it can look like this is the fault of the mother, but it's not. It's just we can only link the child to the mum, which is hopefully that will improve in future. But so it's the amount of total adults in the household. That's quite a high risk factor if you've got more. But as we've encountered from the PPI group, it's not just a risk factor, that it can be a benefit as well.
Yeah.
It's if the mother has a young or if the mother has a young age when the baby's born.
Yeah.
The gestational age of the baby. So if they were born early, that's a risk factor. And then some other things, like we found that in the children who become looked after, 40% of their mothers have an alcohol abuse code, whereas I think it's like 12% in the general population. So that's quite high. But then the same for anxiety. Maternal anxiety is really high in the children who are taken into care compared to those who aren't.
So. And then you've got the some of the protective factors that can help the children then.
Yes, there are, for example, it can be if they might be in the deprivation WIMD score 5, which is 1. 1 is the worst, I think. Yes. 1 is the most deprived and 5 is the least deprived. But in deprivation score 1, they're quite deprived. But if they've got the Flying Start intervention, if they've got all this other support, they're more likely to be able to stay with their parents than be taken into care. So there are things like that too.
And then the outcomes then are the health and the education and employment. Yeah, that's so. And when these all sort of come together, when you take into account the risk factors and the protective factors and the outcomes, are we looking at a positive? Is it like how does that help children thrive?
I'm hoping it will, because we know the risk factors. We can then help people put in more interventions or put more interventions in place. Yeah. And it'd be more at a community level, I think, rather than individually. Yeah. So having a community approach to helping keep children in care, not in care, in their homes is probably best. Yeah.
So having more sort of people working together to support.
Yes. So bringing the village back.
Bringing the village back. So going back to the risk factors a little bit, are there any approaches that you've used that have been different, or have you learned anything from other models that you've used to adapt how you look at this?
Yeah, so to start off with, we had a PhD student who helped us, and we've got 2 papers that have been published or will be published, one's in the works. And that's to do with, we did a huge systematic review of reviews. So we looked at every single bit of literature that's out there to work out what the risk factors were. And then we used that to inform the risk factors we were going to look at, along with the risk factors that the PPI group said they wanted to look at.
Yeah.
So we've used both literature, so academic, and then the social side with the PPI to form this data bank of codes that we then want to look at to see which ones are the most predictive of a child going into care.
And that's sort of, like you said, that's used in previous studies then to inform how you're going forward, isn't it? So your findings then, are they going to be used to inform the care sector?
Yes, hopefully.
Yeah.
One of the co-apps on the grant is from the Welsh Centre for Public Policy. Yes, WCPP.
Yeah.
It's a bit of a mouthful.
It is, isn't it? Yeah. But so your findings then will help inform like the care sector policy, health services, and generally just support children and young people.
Yes, we're going to... it's my goal is to make sure this research goes really far and gets picked up by quite a lot of different news articles and everything, just to get it out there to help inform like policy and make a change, because that's really what I want to do. I want to make a change and make a difference.
But so will this be followed over time then? Because you talked a bit at the beginning about a longitudinal study. Going forward then, is this something that will continue to...
Yeah, so the Serena, the European project, that is actually able to look at more data, so we can use the more up-to-date data from 2020.
Oh, wow.
So it's already going to be going ahead and looking a bit further forwards. So hopefully we can then... I would like to apply for another grant to further develop this model, because currently we're just looking at birth characteristics, but we did find that other characteristics come into play at, say, 1 year, 5 years and 10 years. So I'd quite like to apply for another grant and then hopefully win it to make this model more accurate and to maybe allow it to add more factors at different times to see how that risk changes over time.
And ultimately just again improve the outcomes even further. So given that this is a healthy ageing and podcast, do you think that these early interventions will make a difference to...
Definitely, because if you get taken into care and then you have better health outcomes, we have also found that education wise the attendance goes up, but the attainment doesn't so much. So I'd quite like to work out why that is. But if we can get more children who do go into care and then allow them to get jobs, they can then work, they can have a really good quality of life, they might be able to save up to then go on holidays and just have a better quality of life than not.
Yeah.
And then if they're healthier, then they're going to live longer.
Yeah.
So,
and also be in the system, actually visiting the GPs.
Yes.
And, getting... So are there any surprises in your research that...
I think the surprise was that while attendant goes up, attainment doesn't go up. I think that was a surprise for me, because I was like, they're going to school more. That's good. Yeah. They're able to learn more. But then actually it might be that they're struggling with reading or they're catching up. Because I was quite sad when I saw that at foundation phase, the children who go into care, 50% of them fail then. That made me quite sad. Yeah. I said, this is really sad. They should be And then I looked up the questions for foundation phase, and I was going, oh no, they're failing this early with these sort of questions. What can I do to change this? So I was just like, I feel really responsible that this is happening to them. I got really like, oh no.
But that's amazing though, because this is the sort of thing that inspires research further, and now you've got something that I want to know why, and you're looking at why. and this is just like why I love doing this, because the research, it's just like, I love where it can go, and and how far it's come. Like you're looking at data from, like you said, 2000 up to 2020. Oh, I've got so much more we can talk about, but when you move on to your next stage, can you please come back and tell us more, because you're going to win.
I hope so.
Oh no, in all seriousness, we are running a little bit out of time, but thank you so much for coming in to talk to us. If people want to find out more, can they reach out to you and Carelink?
Yes, there's on the Centre for Population Health, we have a website there, or a page there for Carelink.
And they can reach out. And also, if you would like to reach out via us, you can visit us at the Healthy Aging and Chronic Conditions Research Institute. Thank you so much for coming in to speak to us. That was fascinating.
Thank you.